Hello everyone, dear friends. I want to continue my presentation and we'll start from the second part of our discussion as to the main symptoms and syndromes in kidney pathology. So let's go on and we will start this part with the yellowish box of main major syndromes. What are they? Nephrotic syndrome, nephritic syndrome, REMIA, renal failure syndrome, and the basic one, nephrotic syndrome, and the base sign of it is proteinuria. It is the presence of proteins in the urine. And key points for the first, forming urine while urination, and only severe proteinuria can cause nephrotic syndrome. And in normal cases, plasma proteins remain within this circulation in the case of normal glomerular basement membrane. And in the case of pathology, for the first, it will be glomerulonephritis, when liquid glomerular basement membrane will be damaged and plasma proteins cross the damaged glomerular filtration barrier and pass into the urine. And let's go on and we will look to the left part of this very important scheme. And you see here in the center nephrotic syndrome, and the main sign of it, hypoalbuminemia on the base of selective proteinuria, and it will be albuminuria. So impaired plasma oncotic pressure, decreased plasma albumin concentration, and you see here the data, is the way to what? To hypovolemia and water transudation into interstitium. So, but look here, and you will see that the next step of pathological process is increased synthesis of renin, angiotensin, aldosterone system, and enlarged production of antidiuretic hormone and high level of catecholamines, and decrease the synthesis of atrium natriuretic hormone. So, and as you see here, there also be generalized capillary permeability, which causes all the set of the problems. But what you have to know, and I want to go back you to understand that secondary sodium and water retention is the next step, and it will be the last or the first at the composition of all these problems. And you will knowledges I associate today of formation of this edema and these problems of nephrotic syndrome is the primary sodium and water retention, associated also with the proteinuria and selected proteinuria as the very important sign. So let's go on. There we see proteinuria, and it will be the type of proteinuria on the level of tubulointestinal structures and glomerular structures problems, and they will accompany each other forms of the glomerular interstitial crosstalk and the pathological circle of problems. And what are they? So as you see here, sodium absorption will be enlarged, and a higher level of angiotensin 2 and low level of oxide in the blood. So, and as you see here, the same less of filtrated sodium causes the high level of it in the blood. And as you see here, the underline the information about what I previously announced you, primary sodium retention. And it will be the main sign for today in understanding of pathophysiology of severe edema in the case of kidneys damage. So let's go on. And nephritic syndrome definition. As you see here, clinical and laboratory syndrome characterized by, as we told before, massive proteinuria, which leads to hypoproteinemia. And you see here, it will be massive proteinuria is which data is by 3.5 gram as to 24 hours excretion, and it will be hypoalbuminemia, which causes the compensatory mechanism of production of lipids. And as you see here, cholesterol usually elevated more than 10 millimole per liter, and hyperlipidemia is also typical as the third component of triad of nephrotic syndrome. And then you see here pitting edema. It may be, or it may be without edema, but it will be three components of this triad. So massive proteinuria, then hyperproteinemia for the first hypoalbuminemia, and as you see here, it may be pitting edema as this sign. And let's go next step. And as to the symptoms, clinical symptoms, they are not involved into the syndrome, but you may receive such physical symptoms and signs as to this syndrome. So what it will be? Foamy urine, as we told previously. Then it will be swollen face. It will be shortness of breath on the base of overload in the lungs, for example, and the whole body. And as you see here, so there may be fatigue. Fatigue as the very important sign of these problems. And let's go on, and we can use a strip for identification of proteins in the urine. And you see here the different level of different colors of the strips. They may help us for screening such patients. So let's go on to the nephritic syndrome, how to identify it. And we will identify key points for the first, for the definition. What is it? It's also clinical and laboratory syndrome associated with disorders affecting the kidneys, more specifically glomerular structures, and characterized by having a thin glomerular basement membrane and small pores in the podocytes of the glomerulus large enough to permit proteins, proteinuria, or red blood cells, hematuria, to pass into the urine. So we will recognize these signs as laboratory signs. So let's look at this funny picture. It is also will help us to understand the problems. And as you see here, left side nephritic syndrome and right side nephrotic syndrome. Key points, what are they? Look here. Here is inflammation, makes glomerular basement leaky, and hematuria causes, goes to the urine, and cola-colored urine appears as the sign. And what is at the nephrotic syndrome will be the main as to the damage of the unit of nephrons. So podocyte damage, you see here, leading to glomerular change, barrier disruption, and massive proteinuria. What is it? More than 3.5 grams per 24 hours. So let's go on, and we will look for nephritic syndrome criteria. What are they? Key points: hematuria, so red blood cells in the urine, gross hematuria. We can visually receive this sign. Then it will be hypertension, it is typical. As you remember, it is not typical for nephrotic syndrome, but here it is the very important sign. So high blood pressure as data more than 140 and 90 millimeters mercury. Azotemia, renal insufficiency, increased level of serum urea and creatinine. And you see here proteinuria also, but less than 3.5 gram per day. And oliguria is typical, low urine output, less than 400 milliliters per day. So that's why nephritic syndrome appears. So let's go, and this funny picture will help us to divide the criteria of these two important syndromes, because we have to identify them to plan the effective management of the patient. So let's repeat: nephrotic syndrome. So look here, hypoalbuminemia on the base of walls of massive for the first selective proteinuria, albuminuria. So then compensatory mechanism of hyperlipidemia and the transporting function of proteins, lipids take on, and peripheral edema, more typical for this syndrome. And what about nephritic type? Look here, high blood pressure, the problems with glomerular structure and function, and oliguria here. And as you see here, there will be color-colored urine with hematuria, gross hematuria, and there will be the main signs of this problem. So renal failure syndrome and terminal stage will be uremia. So it is condition of having high levels of urea in the blood. Uremic syndrome can be defined as the terminal clinical manifestation of kidney failure, also called as renal failure. So let's go on, and you can see here the damaged kidney and its structure doesn't permit perfect function and effective exertion of the urine. So for the first, acute renal failure and its causes. Prerenal acute failure. So as you see, systemic types as to heart failure, blood or fluid loss, then post-renal on this level, it will be more of an obstruction by stones, tumors, or maybe clots. And intrinsic renal disease may cause also acute renal failure. And for the first, it will be acute tubular necrosis for 85% of the causes, toxic or septic problems of kidney function, then glomerular disease, as you see here. And let's go on to understand symptoms and signs of acute kidney failure. So, how we speak today? We speak about acute kidney injury, previously called acute renal failure. So acute kidney injury is a sudden episodes of kidney failure, refers to an abrupt decrease in kidney function or kidney damage that happens within a few hours or a few days. and that is possibly can be reversible. And what is it? Decreased urine output, fluid retention, shortness of breath, fatigue, confusion, nausea, weakness, irregular heartbeat, chest pain or pressure, and up to the coma in severe cases. So let's go on. And criteria. What are they? Increase in serum of creatinine more than 0.3 milligrams deciliter within 48 hours, increase in serum creatinine more than 1.5 times baseline within 7 days, urine volume less than 0.5 milliliters per kilogram in 6 hours. So let's go on, and as you see here, criteria. We name them, and then the severity. As you see here, the stage 1, baseline of elevated serum creatinine up to 100% as to baseline. So the next up to 200%, it will be the second stage. And then it will be the third one, of the most severe. And you see these patients which serum creatinine is more than 200% higher than baseline. They need renal replacements therapy or dialysis. So let's go on, and we will speak about the very important problem of today's mankind, chronic kidney disease. What is the definition? Chronic kidney disease is defined as abnormalities of kidney structure or function present for the 3 or more than 3 months with implications for the health. So let's go on. And what are the markers of kidney damage? As you see here, what we spoke about. So albuminuria, you see more than 30 milligrams per 24 hours, and urine sediment abnormalities. We know about that syndrome. Then electrolyte and other abnormalities as to the tubular disorders, abnormalities detected by histology, structural abnormalities detected by imaging, or history of kidney transplantation. So, and as you see here, we have to pay attention to this very important test to understand this sign as glomerular filtration rate, which is very important for today for classification of the severity of chronic kidney disease. And in the case of chronic kidney disease, this rate will be less than 60 millimeters per minute, 1.73 millimeters twice. So it will be the severe category of the dysfunction of the kidneys, and it will be the category of 3A and terminal 5. So look here, and we have to remember this criteria, glomerular filtration rate. So you see GFR, and you have to know that very important sign will be the blood urea nitrogen data. So these signs in the blood you have to know. So, and for today, you have to estimate glomerular filtration rate, and you have to use formula EPI for epidemiological collaboration group, and by the electronic devices and knowledge of the level of creatinine and the age or sex of the person, we may calculate it. And as you see here, there will be the stages of chronic kidney disease. You have only to know how to use them. But I want to stress that the same you have to use in the same time in the analysis of the status of your patients, also the level of albuminuria. And as you see here, from green to deep red, we can understand the prognosis for the evolution of the chronic kidney disease and the type of treatment. And as you see here, it's not funny picture you see, but it's the picture you have to understand the level of kidney function and filtration rate. And as you see here, the mild second, moderate third, and severe fourth and fifth level of filtration function of the kidneys is the way to wear for renal replacement therapy, dialysis or transplantation if you rank. So let's go on. And what I want to stress for you, that clinical features of uremia are the same. So you see here, all the organs are involved into pathological process: nervous system, central and peripheral gastrointestinal system. Hematological disorders may cause kidneys damage, cardiovascular problems, skin and endocrinological signs will appear, skeleton, nutritional and immunity status will be damaged. And you see here a lot of signs. You may stop this slide to identify the details. So let's go, and here this picture shows us the common symptoms and signs of chronic kidney failure. And as you see here, no place on the body where you won't receive some disorders. So that's why renal are the vital, important organ. And we have to understand that to prefer the terminal stages. So I want to show you quickly the physical signs in kidney chronic disease. So you see typical pit edema and the type of pale yellowish edema, for example, in these cases, and both sides, paraorbital and face edematous facies nephritica for both sex patients. And as you see here, also different types of disorders. And as you see here, on the early stages, the bleeding appears, gums and nose for the first, as to disorders of thrombocytes and disorders of endothelium function of the vessels. So, and high blood pressure, as you see here. So the next physical signs start from the mouth and the status of mucosa. And as you see here, different disorders with erosions and so on, so on. So the next line of signs, you may look here and take a look of different details. For example, gout attacks or reactive arthritis may be typical for these patients. And at the terminal stage, you see here disorders of consciousness and coma here, and you also see nephrotic phase, and you see nephritic frost because the skin takes the excretion function from kidneys because of their severe dysfunction. So, and I want to show you the glomerular disease and typical anasarca for kidney chronic disease for the first. And you see as to the colors and type of edematous features typical for heart failure or liver failure, and you easily can recognize this patient as to the color, as to the nephritic face, faces, and so on. You have to be very attentive to check all these signs. So, and at this picture, I want to show you the fourth position of this person with orthopnea as to the lung edema on the base of overload of retention of the water and anasarca in this clinical case, in the yellowish edema and ascites. So let's go on, and you have to know that this patient needs to be detailed by blood tests. So what you have to know, serum creatinine. So you see normal D8 in milligrams per deciliter or milligrams per liter, and you have to remember these levels. They may deviate in different sex, but you have to know the normal variations to your level of knowledge. Then as to the rate of glomerular filtration, you have to know to count for your patient. Then blood urine nitrogen, and you see here normal ranges, and then hemoglobin in the blood, it will be low on the level of the erythropoietin, which will be decreased on the base of dysfunction of kidneys. Electrolytes, so sodium, potassium, chloride, and bicarbonate will be changed, and it will be life important parameters for the patient. Then, as you see here, you have to control calcium levels. They will be lower. And for the first, you see here, sorry, they will be increasing kidney diseases. And anti-nuclear antibodies may help you to understand the autoimmune damage of the kidneys with renal failure. Let's go on, and I want to stress disorders which can you receive while taking ECG. And so you see here the effects of progressive hyperkalemia on the ECG, and it happens on the base of serum potassium concentration, and as you see here, it is very high. And as you see here, there will be the disorders at the repolarization period of ECG, and enlarged ST segment and very high T waves will tell you about, you have to check the level of potassium in the blood. So it also may cause bradycardia or disorders of conduction function. And I want to show you another type of disorders to to compare with the previous one. This ECG is typical for hyperkalemia. And let's go to the imaging abilities. And as you know, for today, the very high level of technical instrumental methods of examination may help us to visualize the kidneys. So renal sonography, as you see here, different types of structural disorders may be identified by renal sonography. Then it will be abilities of renal color Doppler or endoscopic ultrasonographic examination may help you to understand the details of the problems. Then excretory urography, but now it's not so important because we have computer tomography, and we may receive the information about about tumor, for example, or CT angiography, for example, will tell us about disorders of renal artery circulation as the cause of resistance hypertension. Or magnetic resonance imaging may show us the level of obstruction of the urinary tract and location of the stones in the kidney. So, and other disorders which may help us to understand the problems. So, renal angiography, and the next I want to stress the isotope renogram, and as you see here, right side kidney less of function up to only 40%, as to the left one, which shows us the satisfaction of function as to 60%, as to posterior view. So renal biopsy is the gold standard for instrumental examination. And as you see here, we may use ultrasound, renal biopsy to go by the control of ultrasound techniques into the kidney to receive the material for histological examination. So normal structure of the kidney, and there is different types of disorders which may help us to go to the perfect, effective plan of management of such a patient. So I want to thank you for your attention, and I want to highlight for you that you have to be effective on the basis of your knowledges in the diagnostic process of the early stages of kidneys problems to save their quality of life and their life during your practice. So thank you very much for your attention. Be safe and be healthy. So